this edition of Border Report Live. My name is Rudy Mireles, and I am your host here in Harlingen, Texas, in the Rio Grande Valley of deep South Texas. Got an incredible program lined up for you today. We're going to be speaking with Associate Professor in the Department of History and of Science at Harvard University and author of the new book, The Care of Foreigners, How Immigrant Physicians Changed U.S. Healthcare, Ms. Iram Alam. A little bit later, our Sandra Sanchez, South Texas correspondent, is going to be leading that conversation. So I'm looking forward to hearing all about this new book and all the information that we're going to get from this book. But first, let's take a look, as we always do, at what's making news across the border, starting with President Donald Trump saying the Illinois governor and Chicago mayor, both Democrats, should be jailed because they're against his deployment of the National Guard. Now, he called up the troops as part of his immigration and crime crackdown in the nation's third largest city. Trump made the comment in a social media post on Wednesday. Now, he has repeatedly called for his opponents to be prosecuted or locked up. Trump wrote on his social media platform Truth Social that Mayor Brandon Johnson and Governor J.B. Pritzker should, quote, be in jail for failing to protect U.S. immigrations and customs enforcement officers. On X, the social media platform formerly known as Twitter, Johnson said, "This is not the first time Trump has tried to have a black man unjustly arrested. I'm not going anywhere." Also on X, Pritzker posted, "I will not back down. Trump is now calling for the arrest of elected representatives checking his power. What else is left on the path to full-blown authoritarianism?" Moving on, Pope Leo told U.S. bishops visiting him at the Vatican today that they need to address how immigrants are being treated by President Donald Trump's hardline immigration policies. The Bishop of El Paso gave the pontiff a pack of letters from immigrants describing their fear that they and their loved ones will be rounded up and deported. Bishop Mark Seitz, who took part in the meeting, said the Pope vowed to stand with them and the Catholic leaders who are trying to help them. Catholic leaders in the U.S. have denounced the Trump administration's crackdown, which has split up families, incited fears, and upended lives in American churches and schools that serve migrant communities. The administration has defended the crackdown as safeguarding public safety and national security. And speaking of clergy, a Chicago priest is on a pilgrimage to New York to highlight the plight of immigrants in the United States. Father Gary Graff left Dolton, Illinois, on his way to the Statue of Liberty in New York City in hopes of raising awareness for immigration reform. He started the 800-mile trek on Monday morning. Graff is a member of the group of Priests for Justice for Immigrants.
So this pilgrimage is intended to mobilize Americans from every state to demand that compassion, humanity, and helping hands be restored to the immigration process. It is about families and children and about walking in faith.
And sorry about that technical difficulty there. Father Graff told radio station WBEZ... Sorry about that again. He told WBEZ that he started his journey at the home where Pope Leo was actually raised, and he hopes to reach Ellis Island by December 1st. He's planning to walk about 20 miles a day. Time now to bring in our South Texas correspondent, Sandra Sanchez, and our guest for today's program, who I'll let Sandra introduce.
Thanks, Rudy. I was afraid you were going to end us before we even got a chance to talk to Professor Iram Alam with Harvard University. You've written this book, The Care of Foreigners, How Immigrant Physicians Changed U.S. Healthcare. Welcome to the show.
Thank you. I'm really happy to be here.
Now, I got about halfway through the book. Really interesting. And what really struck me was you write that nearly 1 in 4 doctors in the U.S. are foreign born. Many are from South Asia and serve in rural and underserved communities. So let's start out. How have these physicians helped the U.S. healthcare system?
So these physicians are really the backbone of the U.S. healthcare system. Since 1965, for the last 60 years, they have come into underserved rural and urban communities and worked in community hospitals, public hospitals, safety net hospitals, providing the kinds of primary care that U.S. physicians were not really providing. So they're often working in family medicine, internal medicine, pediatrics, really the kind of workhorse of the whole medical profession. And they've been on the front lines and on the forefront of this care for said, the last 60 years. And this isn't just a small percentage of the labor force, as you said, it's a quarter of the physicians that are working in this country that are immigrant physicians. And they, are really shouldering a lot of this care work.
That's an amazing number. I don't think a lot of people know that. Let's take it to today, where we have new rules under the Trump administration for H-1B visa holders. And many of these physicians fall under that category. The cost has been raised to $100,000 from $2,000 or $5,000 for their employment previously. So how will this new rise in cost affect foreign-born physicians from coming to the United States, do you suspect?
Yeah, I think it's going to have a really, really adverse impact on a lot of the healthcare infrastructure. So these physicians are working in hospitals that now the hospitals have to shoulder the burden of paying for visa sponsorship. So previously it used to be anywhere from $2,000 to $5,000, and now it's going up to $100,000 per person that's coming. So in many community hospitals, safety net hospitals, all of the physicians are immigrant physicians. So all of a sudden you go from, say you have 10 physicians on staff, and the hospitals now have to find $1 million.
$1 million? Wow.
If they have 10 physicians, $1 million in order to just sponsor the visas of these people to come and do this work. And that's just extremely cost prohibitive for a lot of these places that are already operating on razor thin margins. They're providing care to the most vulnerable people in this country. And what is going to happen is that these hospitals are not going to be able to bring as many physicians, which means that if you had 10 physicians before, now you'll have 7 who have to do the care work of 10 previously. So I think this is going to have a huge, huge impact on the health care infrastructure, and especially in these marginalized communities where there's an abundance of these physicians.
Do you have an idea specifically what regions or what areas these foreign-born physicians help? I know you mentioned, very rural areas, but here in South Texas along the border, we have had trouble attracting physicians, and we do have a lot of foreign-born physicians who've come in and stepped in. Are there certain areas, pockets of the country specifically attract foreign-born physicians?
Yeah, so, part of their whole visa infrastructure is that they have to work in what's considered to be a shortage area community in the country. And shortage area is designated by having one physician for 3,500 patients. So these areas are concentrated definitely in rural communities, but even within urban areas. So I'm from Chicago, which, the last segment was really, really heavily focused on. And even in Chicago, you can have shortage areas, which just means that there are certain hospitals or certain communities that are not able to attract physicians or retain physicians, so that you don't have that physician to population ratio. So they're really everywhere. They're really heavily concentrated in rural communities. And like you said, in these border communities where U.S. trained physicians often aren't working.
You wrote that they're often met with suspicion in U.S. communities. That happens. I mean, people from other countries face that all the time. This obviously is no different for these highly educated physicians who come to help. What's the lure for the foreign-born physician to come? Do they get this feedback from others? Do some of them come and then turn around and leave because they're just not happy?
Yeah, I think that the lure of coming is, people are always wanting something else, and they come because they want something better. And often, in the research that I did, they would say, well, South Asia is a huge sending country, Pakistan and India, and that the infrastructure there was just not as robust. And so sometimes they couldn't do the kind of care work that they wanted to do. And so they came to the US for different kinds of training, for different kinds of possibilities for their families, for their children. I mean, the same kinds of reasons why any other group of immigrant comes to this country. Having skills gave them a little bit of a certain kind of advantage because they were able to take advantage of these specific visas. But it's the same all across the spectrum of why people end up coming. And I think that, yeah, they were met with suspicion because all of a sudden, previously, especially prior to the 1960s, physicians are white and they're men. And now all of a sudden you have this foreign trained expert who's coming and doing this intimate work of life and death and illness. That takes a lot of vulnerability on all parts to go into the clinical interaction. It's really a space of, you're scared and you're in pain. And so I think that they had to do a lot of work in order to, make sure that they could effect a positive therapeutic encounter with the people that they were working with. And it wasn't always easy, and they were met with suspicion. And, do you know what you're actually doing? Do you have the expertise? Are you competent enough? This was constantly the kind of these ideas that they were confronted with. And so they had to prove themselves over and over and over again. And I think, even if they had this skill and this expertise, the fact of them being a foreigner, that is always going to cause some level of suspicion.
You mentioned the 1960s, and I know in the book you talked about the immigration policy, so I'm going to let you explain it. What opened the door to bring these physicians here?
Yeah, so, it's just 60 years ago on October 3rd, our whole immigration infrastructure changed. So prior to 1965, the US was a very closed, isolationist kind of place when it came to immigration policy. Nativist sentiments were all over the place. And then in 1965, as the US was in the midst of the Cold War and realized, if we tell all of these countries that are these newly emergent post-colonial nations that previously who couldn't come to the United States, if we tell them, hey, we want you to become democratic, we want you to join our capitalist fold, don't go towards the communists, but you actually can't come here. We don't want anybody to enter into this country. That's just not going to fly. It's kind of suspicious posture. So immigration in 1965 really changed as a kind of foreign policy move. And then in addition, you have 3 months before this immigration bill passed, Medicare and Medicaid passed. So Medicare, people over 65 entering into the medical marketplace, and then Medicaid, people who are low income. So just imagine overnight, 20 million people are now able to access medical services. Who's going to actually provide that care? So immigration becomes this really useful mechanism for being able to quickly staff these places.
We're speaking with Associate Professor in the Department of the History of Science at Harvard University and author of the new book, The Care of Foreigners, How Immigrant Physicians Changed U.S. Healthcare, Professor Iram Alam. We're going to take a quick break, but we're going to continue the conversation immediately after, so stay with us. Border Report Live is back in 1 minute. And welcome back to Border Report Live. My name is Rudy Mireles. Joining us today, South Texas correspondent Sandra Sanchez, an associate professor at Harvard University and author of the new book, The Care of Foreigners, Professor Iram Alam.
Professor, right before we left, you were talking about Medicare, Medicaid, the need to get more physicians for people who were insured. This is really timely what's happening now because we have a government shutdown in its second week. And part of the issue is Democrats don't want Obamacare tax subsidies to expire. Republicans say, we'll talk about it afterwards, just open up the government. But you wrote in your book that actually it was the passage of Obamacare that also instigated the need for additional physicians, and many foreign physicians came to replace to add this service, right? So what will happen if these subsidies aren't continued?
Again, you're going to have, the estimates are anywhere from, I think, 6 to 11 million people who are going to lose access to healthcare. And, where are they going to go is really an open question. How are they going to find the care that they need? And yeah, the Affordable Care Act, because it focused on preventative care, it focused on really bolstering this first line of defense. So family medicine, internal medicine, and pediatrics, that you need to have the people to actually be able to do that. And even just this year, I think it was the numbers, 40% of immigrant physicians went into those specialties. And those are the specialties that are the least lucrative. They're the ones that U.S. trained physicians don't want to go to, but they're the ones that are so vital for coordinating care for people, for making sure that you don't end up at the place of the emergency room where the costs are extremely, extremely high, and that you have access to a provider where you can get screened and seen and things taken care of before they get to that really, really intense level. So that was the whole logic behind the Affordable Care Act, that in fact, making that system more robust in the end is actually going to save more money, which it does ultimately, because again, you're not finding people when they're in the most terminal stages with the most acute crises. You're addressing things much earlier on. And immigrant physicians, they really got recruited into this whole workforce calculation that was going on. There was an expectation that they were going to come, that they're going to work in, again, these shortage area communities all throughout the country, and they're the ones who are going to be really on the front line.
Now, the Trump administration has implemented policies that are very anti-immigrant. They want U.S. jobs for U.S. citizens. Are foreign physicians still coming here? You mentioned July 1st there was going to start a new residency class. Do you know what the numbers are? Did they drop in those applicants wanting to come here to the United States to be doctors?
Yeah. Yeah, no, it's a great question. And I think it's one that we'll see the effects of, especially in July 1st, 2026. So I think when a lot of this stuff was starting to really gain momentum in March, April, when visa interviews were suspended at all embassies abroad, many people had already secured their visas prior to when all of this stuff happened. And so they were still able to come by that initial July 1st deadline. But there were reports of stories where there was a lag that happened because so what happened was Marco Rubio said no more visa interviews. And then they realized, oh, shoot, what about the physicians? So then they had to have an exception where they said, oh, let's expedite the entry of the physicians. Everybody else we can just keep, on the back burner. So they let the physicians in, but it was kind of in a time lag. So I think this year we're starting to see, probably most of the people who intended to come July 1st were able to come. But I do think that the fact of the starts and stops, the fact that things have gotten even more out of control than they were previously will likely change where people end up going. They could go to the UK, which, although has a lot of anti-immigrant sentiment, does still have a pretty predictable pathway for physicians to go. Canada will welcome them. Australia will welcome them. And I think that people will just make those choices. I mean, that in addition to just the rising hate crimes and the xenophobia, think people make different choices.
Pardon my ignorance, because when you mentioned physicians, got this expedited approval entry, how did they prove who they were? Did they have to send copies of their certification from graduating from their medical school in their home country? Did they carry a card? Do you just walk around with a stethoscope? I mean, at this point, what did they do?
Yeah, it's actually, they have to produce a huge, huge pile of documents, which is, I think, the state of, in fact, all immigrants, who walk around with piles and piles of documents to have to prove who they are, what they know, that they actually belong. So they have to go through a whole procedure of taking a bunch of tests, getting their credentials validated, securing employment, securing their visa, having, all of that paperwork in order for them to actually be able to cross into the country and start to work. They have to get licenses for states in order to be in medical practice. So it's a pretty complicated procedure that they have to undergo, but it now, the last 60 years has become so streamlined because they're so essential to the workings of the everyday healthcare system.
There was another startling fact in the book. The American Medical Association official you quoted said 21 million people live in U.S. areas where foreign-trained physicians account for at least half of all the physicians. This was during the COVID pandemic. And the AMA predicts a shortage of 86,000 physicians by 2036 in the United States. So we need these foreign physicians to come, right?
Yeah, we absolutely need them because we cannot, this executive order is all about growing physicians, improving the labor force in the United States. it's going to take at least 25 years to make one physician. If you've decimated all of the educational infrastructure, if there's no STEM learning in high school, if you don't have any of that, you can't make a physician in the United States.
Well, let's talk
If
about.
it's so expensive.
Oh, go ahead.
No, I was just saying, and on top of that, it's so cost prohibitive. It's so expensive. So even if people want to go, it is generally a very wealthy and elite group of people who are able to access the profession.
So let's talk about the ethics about this. Earlier, you mentioned India, and apparently India has only 9 doctors per 10,000 people. The U.S. has 26 doctors per 10,000 people. How is this exodus of foreign-born doctors from India to the United States hurting India? And ethically, I mean, should we be doing this? Is this, hurting the healthcare of another country?
Yeah. Yeah, I mean, it's a question that, since this migration started has been on the minds of people who really think about, the distribution of labor across the globe is really an important thing in thinking about health equity and how we balance these kinds of things. And so it's hard to say to people because freedom of movement is such an essential human right. So it's hard to say, don't come. But I think that we have to rethink, how do we incentivize people to stay? How do we create systems or develop a much more robust infrastructure where we start relying on community healthcare workers, nurses, PAs? We start reimagining what healthcare actually is so that that number, the 9 to 10,000, is different and it looks different, and as well as in the United States, because both of these places have shortages and both of these places have to figure out how to fix that issue.
Well, thank you. I wanted to get a shot of the book here. I did read it. It's a really great read. It is by Johns Hopkins Press. So we've been speaking to Associate Professor Iram Alam. Thank you so much for joining us. Rudy, that was a great conversation.
Yeah, this is definitely one of those ones I wish we didn't have to cut off, but unfortunately we only have 30 minutes. But we appreciate you being here today, Professor Alam, and hopefully we can call again on you in the future.
Thank you. I'm working on medical tourism across the U.S.-Mexico border next.
Oh, well, that is something.
We'll
you'll expect our phone call. All right. Thank you so much, ma'am. Stay with us. Border Report Live is back in 1 minute. And welcome back to this edition of Border Report Live. My name is Rudy Mideles, your host here in Harlingen, Texas, in the Rio Grande Valley of deep South Texas. Got one more headline we wanted to tell you about, and that is that United States liquor exports to Canada fell by 85% in the second quarter of 2025, according to a new report which cited the, quote, adverse impact of ongoing trade tensions. Now, according to the Distilled Spirits Council of the United States, exports to Canada dropped to $9.6 million in the second quarter of 2025. That's down from, get this, $63 million in the second quarter of 2024. So it's from $63 million down to 9.6 in the same period year over year. President Trump announced sweeping tariffs on U.S. trading partners earlier this year, including a 35% tariff on Canada. Now, still, according to the report, the majority of Canadian provinces continue to ban American liquor from their shelves. Canada remains the only key trading partner to retaliate against U.S. liquor. Really quick, before we head out for the day, we wanted to tell you about our partners over at Political Power Ranker. Political Power Ranker is a weekly show tracking the movers, shakers, and rule makers in American politics. Nexstar's Director of Political Content, Chris Berg, and Director of Emerson College Polling, Spencer Kimball, break down who's up and who's down in the world of politics based on data. And if you're anything like me or our South Texas correspondent standing right next to me, Sandra Sanchez, you don't want to miss this show. It combines two of my favorite things, both data and politics. And I can tell you right now, Spencer Kimball is the man when it comes to collecting and analyzing and reporting that data to you. So you won't want to miss out on that. So make sure to check it out. You can find more on Political Power Ranker at abc27.com, or you can check your local Nexstar station's website for more information. Now, if you're just joining us in this live program today, or maybe you're on a delay at one of the many stations across the country, Well, remember, you can always stay informed on the story shaping the U.S.-Mexico border as Border Report Live now brings you real-time updates, expert insights like the one you just heard, and voices from both sides of the border in podcast form. You can catch us now on Apple Podcasts, Spotify, YouTube, and the iHeartRadio app. They're all at the bottom of your screen there today. So make sure to check it out. It's great when you're commuting, you want to catch up, don't have time to watch the show during the day or whenever your local station may be airing it. So make sure to go ahead, subscribe, like, and listen to those episodes today. That's going to do it for us. For Sandra, my name is Rudy. Have a wonderful day.